everybody. This is your eye specialist, your consultant ophthalmologist, Dr. Michael Chuka Kusa, coming to have an encounter with you today. Today we are going to talk about another eye disease. We call that cataract. This is the commonest cause of blindness all over the world. What happens in cataract? The center of the eye, where we call the pupil. If you are not a doctor, you look there, you start seeing a grayish thing there. Instead of the center of the pupil being black, you see it grayish, whitish. Gradually it is milky over many years. This cataract is called opacity of the crystalline lens in the eye. There is a clear thing in the eye we call lens that ought to be clear so that light passes it, you see clearly. But when it becomes opaque, it's like putting a paper in front of your eye. You can't see through. Light can't pass through. Cataract can happen in children. It can happen in adults. The commonest cause I will talk about now is the one we call age-related cataract, the one that is caused due to age. We used to call it senile cataract, but we prefer a more friendly age-related cataract. It happens to people over 40 years of age. What happens to them? They start noticing blurring of vision, difficulty with seeing clearly, far, near. It progresses. At some point, they notice they may not be able to see much. You look in the center of the eye, it's grayish, it is milky. That is cataract. This is age-related, above 40. As I said, it can happen to people less than 40 years of age. In children, we call that congenital cataract. It may be developmental cataract if not exactly very small children. But I'm talking about the age-related one now, those above 40. Look at your eye in the mirror, look at your relative's eye, your friend's eye, you see it, tell them it is treatable. Go and look for an ophthalmologist, eye specialist, eye surgeon. There are a lot of things he will examine in your eye and will advise you what to do. Usually it is surgery, different types of surgery. They remove the cataract and replace it with a different lens. I will advise in places like sub-Saharan Africa, Nigeria and so forth, where a lot of people go around and say they treat cataract without surgery. Sometimes they manipulate things we call couching and destroy the eye. Don't listen to that. Look for an ophthalmologist. It's a fairly straightforward surgery, but there are other things you will look for. Things like trauma, diabetes, and so on. There are other causes of this thing and must be controlled before the procedure is done. What will you take away from this? Cataract can happen to most people. It is treatable by surgery, and very good vision is restored. It is done very well in Nigeria. A lot of Nigerian surgeons do it very well. It's done very well outside Nigeria, advanced countries. It's not too expensive. So, cataract in you or relative, look for an ophthalmologist. You are going to get okay. Thank you for this encounter. We are going to meet next time to discuss another eye disease. Bye-bye for now. This is Dr. Michael Chuka Kosa, your eye specialist and consultant ophthalmologist. Bye.